Doctor, my eyes.
If health matters to you, ask the doc.
Tell me what you see.
Health Matters with Dr. John Darcy.
Each year, almost 45,000 newborn babies require the help of the neonatal intensive care unit or the special care nursery. 25,000 of them are premature and almost 1,000 lose their fight for life. For families experiencing the arrival of a baby in such an unexpected way, it's so life-changing and it's really overwhelming. And having support is so essential. And with me today is Melinda Cruz. Melinda's the co-founder of Miracle Babies, a foundation established to deliver just that. Good morning, Melinda.
Good morning. Thank you for having me.
Now, Melinda, you went through a stressful time with the arrival of both your kids. Tell me about that.
Yeah, I've actually had 3 that were born premature. My first one was born at 34 weeks. And being my first baby, it was definitely a very traumatic time for us. But he did really well, and he spent 3 weeks in hospital with our second son. He came so much earlier at 27 weeks.
Wow.
Really with no warning. I was on bed rest with my first one, but with this one he just surprised us and came. And yes, it was very confronting and very frightening.
And was it this experience that helped you establish Miracle Babies?
Yeah, absolutely. When you're in hospital, and we had 9 weeks with him in hospital, you're really behind closed doors, and you're cocooned within a beautiful community of doctors and nurses and other families that have gone through what you've gone through. And when we were discharged and had to go home and have this baby home, it was extremely confronting, very isolating. I suffered quite a bit of anxiety, and I was very fearful of him getting sick.
That's right, because you must feel so alone at home after all that time in nursery.
Absolutely. I have a large family around me, but the first person to have a premature baby, and it just felt like no one really understood what I was going through. And I was desperate to be linked to other families and or to stay, around people that knew what I was going through or had gone through a similar experience, and was really surprised at the time to find out that Australia had no national organisation.
And that's what you've done, Melinda. You've set up Miracle Babies. What sort of support is now available for families in situations like yours?
Yeah, so we have what we call our Nurture program, and that's really a complete family support program from a threatened pregnancy during their time during hospital, and then once their children go home, right up until 6 years of age and they're ready for school, and then even beyond. And that consists of, a 24-hour family line. We have in-hospital face-to-face parent support. We have discharge groups on the ground, loads of information and loads of resources. So,
Melinda, is this available right around Australia?
Absolutely.
Oh, gosh, that's magnificent.
Yeah, absolutely. It's needed everywhere.
It is needed, and I know for a fact, being a doctor in general practice, very often you're doing a late-night call. To be able to ring somebody who really knows what's happening to that family is just wonderful. So even for us docs, it's fantastic to have Miracle Babies. So thank you so much for coming on Health Matters.
Thank you for having me.
Our pleasure.
For support or to learn more, head to miraclebabies.org.au, or to continue the conversation, feel free to check out Health Matters with Dr. John Darcy on Facebook.
After the break, know your numbers.